Okay, we're going to talk about pediatric skin, adult skin versus pediatric skin. So we're talking about the differences. So infant skin is very thin and there's underlying subcutaneous fat. So this tends to cause the infant to lose heat rapidly, and they have a difficult time regulating body temperature because of this, and they become more easily chilled. Infants cannot shiver to warm up, but they do have brown fat to generate heat. So instead of shivering, this brown fat that's on the infant's body helps them generate heat when they're chilled. Infant skin or pediatric skin contains more water and more loosely attached cells. This leads to an increased absorption of harmful chemicals and an increased risk for bacterial infections. Infant skin has less melanin than at birth, so they tend to be lighter in color. That's why a lot of your babies that are of different ethnicities will still look light after delivery because of the decreased melanin. All right, to talk about a few pediatric skin disorders. Contact dermatitis. It's an inflammatory reaction of the skin. Your ATI book separates diaper dermatitis from other types, but we're just kind of grouping them all together. It's caused when skin comes into contact with chemicals or other irritants. Seborrheic dermatitis or cradle cap. It's an unknown etiology. So treatment would be to remove the irritant. Like if it's diaper dermatitis, make sure you remove the diaper, wash it, expose it to air and allow it to dry. Zinc oxide can be applied. It often is itchy. So for the pruritus, we want to give antihistamines such as Benadryl. Expect antibiotics if there's a secondary infection present or an antifungal if it's needed. And we want to teach patients to avoid infection. So contact dermatitis, if they want to avoid infection, make sure they're washing their hands. They keep short fingernails. They take care of the itching of the skin so it doesn't become infected. Atopic dermatitis, it is an allergy, so it's not from being in contact with an irritant. It cannot be cured, but it can be controlled. It tends to be itchy, so you'll see pruritus. The lesions will disappear if the itching is stopped. We want to keep skin hydrated with tepid baths. Apply ointment within 3 minutes. 2 to 3 baths per day and 1 prior to bedtime is actually recommended. Dress in cotton clothing to reduce the irritation of the skin. Avoid excess heat and avoid irritants. Again, we want to teach them to prevent infection from scratching, so short fingernails, washing their hands. Pedigo is a bacterial infection of the skin. You'll see a reddish macule that becomes vesicular. It erupts easily, secretions dry, and it forms crust. It will spread peripherally and by direct contact. It tends to be itchy as well, so you'll see the pruritus. It's caused from a staphylococcus infection. Treatment can be topical antibiotic ointments or oral antibiotics. We want to teach patients to good hand hygiene to help avoid infections. Keep short fingernails so they can avoid spreading the infection. Avoid sharing clothing, hats, brushes, or towels. Keep the child from touching the affected area by using distraction. Tell them not to squeeze the vesicles. Apply the topical medications as prescribed and give the oral medication as prescribed if that's the case. Acne. So our adolescent populations at increased risk for acne. The big thing with acne that may not have been mentioned in other med-surg classes is you want to monitor for signs of mood changes or suicidal ideation for those taking Accutane. So the medicine Accutane, the generic name of it is isotretinoin. It's highly teratogenic, so it's also contraindicated if the client becomes pregnant. So if they're prescribed this medication, we want to make sure that they're on 2 forms of birth control, such as a contraceptive and then a barrier form. And then also know that they need to report signs of mood changes or suicidal ideation if they're taking the Accutane. Burns. The only real difference with your pediatric burn patient versus your adult, other than fluid replacement, is the extent, the total body surface area. So the rule of 9s in your adult patient, it's calculated differently in your pediatric patient because they're different sizes. So the head is 18% in the kid, where it was 9% in the adult. The legs, adult legs are 18% apiece, and your pediatric legs are 13.5% apiece.